Hello, and welcome to today's compliance tip, Home Health Part 2. Prevent denials, documentation requirements for the Home Health Plan of Care. Part 1 of the Home Health Compliance Tip series addressed documentation of the face-to-face encounter. Our topic today is documentation of the required plan of care. Insufficient documentation accounted for a large portion of improper payments for home health services, according to the Centers of Medicare and Medicaid Services. Documentation was either missing or insufficient to support certification for home health eligibility requirements. The plan of care is documented by either certifying physician and/or the acute post-acute facility. The plan of care must contain supporting documentation to justify the referral for Medicare home health services and the need for skilled services due to homebound status. The required documentation elements of the plan of care include the following: mental status, the type of services, supplies, and equipment required, the frequency of the visits to be made, prognosis, rehabilitation potential, functional limitations, activities permitted, nutritional requirements, all medications and treatments, safety measures to protect against injury, and instructions for timely discharge or referral. If the plan of care includes a course of treatment for therapy services, the physician must establish the course of therapy treatment after any needed consultation with a qualified therapist. The plan must include measurable therapy treatment goals, which pertain directly to the beneficiaries, illness or injury, the beneficiary's resultant impairments. The plan must also include expected duration of therapy services, and lastly, description of a course of treatment which is consistent with the qualified therapist's assessment of the beneficiary's function. The plan of care must be reviewed and signed by the physician who established the plan of care in consultation with the home health agency professional personnel at least every 60 days. Each review of the patient's plan of care must contain the signature of the physician and the date of review. The physician must review and sign the plan of care every 60 days unless the beneficiary transfers to another home agency or gets discharged and returns to home health during the 60-day episode. The orders of the plan of care must indicate the type of services to be provided to the patient, both with respect to the professional who will provide them and the nature of the individual services, as well as the frequency of the services. This example is specific to the number of skilled nursing visits, frequency, and the duration. Orders for care may indicate a specific range in the frequency of visits to ensure that the most appropriate level of services is provided during the 60-day episode to home health patients. When a range of visits is ordered, the upper limit of the range is considered the specific frequency. Here's an example for you. Skilled nursing 2 to 4 times a week for 4 weeks. 1 to 2 times a week for 4 weeks for skilled observation and evaluation of the surgical site. Orders for services to be furnished as needed, or PRN, must be accompanied by a description of the patient's medical signs and symptoms that would occasion a visit and a specific limit on the number of visits to be made under the order before an additional physician order would have to be obtained. The physician who signs the plan of care must be qualified to sign the physician's certification as described in Chapter 42, Code of Federal Regulations, Sections 424.22. Physician practitioners allowed to perform the encounter and draft the plan of care are a nurse practitioner or a clinical nurse specialist, a certified nurse midwife, or a physician assistant. If a physician signed plan of care is not available at the beginning of the episode, the home health agency may submit a request for anticipated payment for initial percentage payment based on physician verbal orders, or a referral prescribing detailed orders for the services to be rendered that is signed and dated by the physician. RAP stands for Request for Anticipated Payment. REP claims obtain 50 to 60% of the anticipated payment at the beginning of the patient's episode. This payment is determined based on the codes generated by the home health agency's OASIS assessment. If the request for anticipated payment submission is based on physician verbal orders, the verbal order must be recorded in the plan of care, include a description of the patient's condition and the services to be provided by the home health agency, include an attestation, and the plan of care is copied and immediately submitted to the physician. A billable visit must be rendered prior to the submission of the request for anticipated payment. For the final percentage payment, the plan of care must be signed and dated by the physician before the claim for each episode for services is submitted for the final percentage payment. Any change in the plan of care must be signed and dated by a physician. The plan of care is considered to be terminated if the patient does not receive at least one covered visit in a 60-day period, since these are qualifying services for the home health benefit. The exception would be the physician document that the interval without such care is appropriate for the treatment of the patient's illness or injury. Learn more about documentation and coding requirements. Consider obtaining your Certified Medical Documentation Professional or CMDP credential. I hope you enjoyed this coding and documentation tip.